Hey, what's up, YouTube? I just wanted to address a question that I often get asked about, and that is, should I be performing core exercises daily for my back pain? Now, the question to this answer isn't straightforward, and it's going to depend on the person's back injury, their symptoms that they present with, and where they are at with their recovery. And so, to specify, someone with some severe back pain, maybe they have sciatica, and they have pain that triggers as soon as they lay on their back. So if that's the case, an exercise like a McGill crunch or glute bridge may be problematic for them and create symptoms. So right there, those exercises may not be a good starting point for this person, and they may have to wait until their symptoms reduce to actually perform those exercises. But in the other case, if they can perform a bird dog or a side plank fine, then those are exercises that they can perform and should aim to perform daily and build up capacity and build up endurance on them. And then eventually when their symptoms may reduce, they can come back and add those exercises in. So there's one instance where symptoms and the person's back injury is going to depend on if they should be performing these exercises daily. And it's going to depend on the exercises as well. Because if someone maybe doesn't have any symptoms or maybe they have minimal symptoms, I'd say they're a little bit lower on the scale, and they can perform these exercises, say the McGill Big 3, glute bridge, clamshell, no problem with no pain, then I would say that they can perform those daily, and then the goal would be to slowly build up on those. So that's maybe adding an additional rep each day, maybe increasing the isometric hold, maybe from 8 seconds to 10 seconds, until they kind of get to a point where they're feeling good. So in Dr. McGill's book, Back Mechanic, he recommends starting off with 2 repetitions with about an 8 to 10 second hold on the McGill Big 3, and then progressing by adding a rep each day up until 6 repetitions. But that's only if you feel good. So if you start off with day 1 and you performed the McGill Big 3, had a 10 second hold on each, and you felt good the next day after waking up, then that'd be your indication maybe to add a 3rd repetition. And then you do the next day, add a 4th repetition. But that's only if you're feeling good, because now if you're feeling bad, you have symptoms, you're not feeling good the next day, then that would be your indication you may have to scale things back and maybe reduce a repetition or 2. So it really depends on where a person is at with their recovery, because recovery is never going to, very rare will ever see just a straightforward recovery. If you're starting at the bottom, you may go up a bit, then you're gonna have a dip, then go up, dip, then you may have a significant dip. All depends, but just to kind of give you an example, and using my recovery is that, there was days in a couple of weeks where I wasn't in a good position after making some strides, and I had to kind of bounce back, as it wasn't kind of a straightforward recovery. And there's other factors at play, such as maybe how good is your spine sparing kind of program. Are you adhering to good spine sparing strategies throughout the day, like minimizing sitting, minimizing bending over, bending properly? A lot of those factors are going to come at play, because if you're only irritating the damaged tissue, it's only going to delay the recovery. So ultimately, to wrap this video up, in summary, should you perform core exercises daily? The goal is to aim to perform them daily, but if you have symptoms with some of these exercises, there's a couple things to consider. Number 1 is, first of all, is your technique on point? Because if technique is not there, or if technique is off, that it can actually trigger symptoms. And if you perform the exercise correctly, maybe that takes away symptoms. Number 2 is, how severe is your back symptoms and back injury? Because that's also going to factor in, because if laying on your back triggers symptoms, a glute bridge, McGill crunch may not be something that you're able to perform right away, and you may have to wait until your symptoms are reduced. So in that case, you may have to just stick to the exercises that you can work with until you get to that point where the symptoms are lower, and you can then slowly add those exercises and then build up on that. So that's in summary. And then I just want to give a final recommendation. If you guys are unsure about how to program these exercises and what you should be following on a daily basis, I would recommend you work with a physiotherapist or a trainer that knows what they're doing, that specializes in back pain. Because if you don't know how to program these properly, then you may not be making the progress that you'd like to make. And at the same time, if you're not performing these exercises correctly, which is most important, then you may only be stalling your recovery and making things worse. So a couple considerations there if you're unsure about things is, hire a therapist, hire a trainer, work with them, and then that way you can kind of get the proper feedback that you need to make a recovery as quick as possible. So just wanted to address that question as it's something I get often asked about. And I hope you guys enjoyed this video and this answers a lot of people's questions or concerns out there about if they should be performing core exercises daily. And if you have any questions, be sure to drop them in the comments below. And until next time, guys, all the best and take care.